What is cardiovascular disease?
Cardiovascular disease is a disease of the blood vessels and heart that includes numerous problems that are caused by atherosclerosis. If you're wondering what atherosclerosis is, it's a condition that develops when plaque builds up in the walls of the arteries. Some non-modifiable risk factors include genetics, ethnicity, and age. Modifiable risk factors include tobacco exposure, hypertension, high cholesterol, obesity, diabetes, mental stress, and sedentary lifestyle. That can be taken, such as walking and Tai Chi. Changing the community's understanding of weightlifting and aerobic activity can help prevent cardiovascular disease.
Walking!
Why do you two ladies enjoy walking here at all?
Well, we enjoy walking outside most of the time, but when it's bad weather,
we were here. In the winter, of course. Although hiking in the winter is fun too, but when it's not safe or stormy or raining, this is certainly an alternative.
Very nice.
And my husband doesn't like hills, so if he ever wants to walk with me, I'm definitely here with him.
yeah, we're really thankful that this is
Yeah.
available to the community.
Absolutely.
It was so wonderful when they opened it to us.
Awesome. How many days a week do you guys walk on average, you have to say?
Walk or here, anywhere.
Anywhere.
We're pretty different, as you can tell by our physique. So she walks more than me. So I probably walk, I don't know, 3 or 4 days a week. I'm sure she's 7
No,
times 2.
no, I'm not. No, I'm probably 3 or 4.
Uh,
Sometimes we walk together outdoors. Sometimes I'm here first thing in the morning.
But we have other activities too, so
Yes.
which if we're not walking, we're doing something else.
Right. And what are some of those activities?
Where?
We love playing tennis.
Oh, very
So
nice.
we did the indoor tennis here
Mhm.
during the winter, and then we play outdoor tennis when
Yeah.
when they put the nets up.
Awesome. Awesome. So how long have you been coming to Allwell? If you had to guess.
I don't know, a year, I guess. When did it
year.
open?
It's actually only been open for 2 years.
Yeah.
So that would probably be
little
about
over a
like
year.
then.
Right.
Yeah.
Yeah. Oh, we also go hiking, snowshoeing, and things like that.
Oh, around the area you guys?
Yes.
Yeah.
Very
Yes.
nice. And
Skiing.
have you
And
noticed
ice
any
skiing.
benefits since you started walking and doing these activities?
Oh yeah.
Yes, walking is great.
Yeah.
Yeah.
Endurance has gone up. Maybe things like
for
that.
sure. I mean, she has a tremendous amount of endurance anyway. My endurance is special. I feel I have a lot more energy.
Yeah, I think it's helped with our tennis too.
Yeah. Oh
and,
yeah.
And the other activities.
And stress and
Yeah, that's the big one. Walking really helps if you're stressed.
your emotional being. Yeah.
Well, thank you very much.
Breaking news. A woman diagnosed with cardiovascular disease walks across country in hopes to reduce her symptoms and raise awareness. Cardiovascular disease continues to be the leading cause of death worldwide. We're going to be live with news reporter Danelia and our guest Stacy.
More likely than men to present the advanced disease and experience higher risk of cardiovascular disease. Knowing that half of Americans today do not participate in physical activity, Stacy has been able to not only physically improve her well-being, but the mentality of millions of Americans. Stacy, what is your reasoning for seeking this long walk?
Well, because of my age, walking is an incredible way to reduce the progression of my cardiovascular disease. 20 to 30 minutes of exercise for approximately 3 to 5 days a week is what my doctor recommended, so I guess that's what entitled me to do this walk.
Another study showed that 72,000 female nursing students who walk 3 hours a week reduce their risk of heart attack by 35%. How does this explain what's going on when someone has cardiovascular disease?
So when you have cardiovascular disease like I did myself, plaque builds up in the walls of arteries, narrowing the path of blood flow. So my doctor told me that walking helps reduce the risk of blood clots, lowering my risk for heart attack, stroke, and high blood pressure.
Sounds like your doctor knows what they're talking about. I have news coming in from Selena now. She's saying a study of 5,000 men and women found that the average American gains 2.2 pounds a year during middle age, but the people who walked in the 15-year study gained much less weight. And now back to Selena in the newsroom.
Thank you for that informative segment on the correlation between cardiovascular disease and walking. And now a short break from our sponsor.
Introducing the AbMaster 3000. Simply sit, twist, and get that six-pack you've been dreaming of.
Join us next week for a segment on weightlifting starring our guest heart surgeon, Dr. Rhodes.
Weightlifting. Action.
Yeah, I am a little bit tired. I just got done weightlifting. Oh, that's fun. Did you do some cardio or just weightlifting? Weightlifting? It is cardio. Not necessarily. How so, Stacy? Well, when you want to increase your heart rate and get better heart health, you do aerobic exercise with muscular strength. So doing muscular strength doesn't just increase your heart rate. Wow, Stacy, I'm learning so much.
Although running and cardio is not Selena's first choice of physical activity, many studies have been conducted in order to see if a link was found between weightlifting and ischemic heart disease. Men with low physical activity requirements within their workplace who also lifted showed higher rates of heart problems than men who participated in physical activity and weight training. The present study demonstrates that aerobic exercise at either high or moderate intensities improve endothelial function and decrease the cardiovascular risk file in obese adults. However, high-intensity aerobic interval training results in a greater improvement in endothelial function and a decrease in cardiovascular disease risk factors in these subjects than moderate-intensity aerobic training.
We have Selena here with us today, who previously believed that weightlifting was the only way to improve her heart health. We also have with us heart surgeon Dr. Rhodes, who is going to explain otherwise. Dr. Rhodes, why shouldn't Selena focus only on weightlifting when it comes to improving her cardiovascular health?
Well, aerobic exercises such as cardio increases endurance, improving cardiovascular health because it weighs higher in the development of maximum oxygen uptake, also known as your VO2 max.
So what you're saying is that Selena should do more cardio than weightlifting?
No. A recent study demonstrated that both aerobic exercises and strength training improved endothelial function and decreased the cardiovascular risk profile.
Well, thank you for the useful information, guys.
You're welcome.
You're welcome.
Tai Chi with Selena.
Tai Chi is an ancient practice originated as a martial art emphasizing harmony with nature and within oneself by accessing and manipulating one's chi or life force. Recently, Tai Chi has been referred to as moving meditation because it focuses on the connection of body, mind, and spirit to facilitate health through focused breathing, relaxation, and movement. Tai Chi also helps lower blood pressure, which results in lower rates of death in patients diagnosed with cardiovascular disease. Tai Chi Chuan has also shown to reduce anxiety, improve mood, and benefit the cardiovascular system. One study conducted showed the results of those participating in Tai Chi who were diagnosed with heart disease. Those who participated in Tai Chi regularly for at least 3 months showed significant improvement in blood pressure, heart rate, and cholesterol levels. Health risks in women in old age, including cardiovascular disease, have been attributed to a failure to maintain exercise earlier in life. However, Tai Chi is considered a low-intensity exercise that conveys multiple aerobic benefits. Exercise training is the cornerstone for cardiac rehab programs. Patients with heart disease and exercise intensities in a 50 to 70% heart rate reserve have been shown to improve functional capacity.
Because of high costs, lack of motivation, and not knowing where to start, many patients do not become involved with programs for the management of cardiovascular disease. However, Tai Chi is prescribed as an alternative exercise program for selected patients due to its many aerobic benefits.
These forms of aerobic exercises are beneficial to cardiac patients as well as the general public.
Despite the fact that weightlifting is beneficial, this form of physical activity should not be used for the prevention of cardiovascular disease within itself. As health promotion majors, it is important to understand the extreme amount of benefits physical activity has on a population, but also knowing what activities can reduce further progression of such diseases like cardiovascular disease.
These findings should be illustrated for the public in order to promote overall health and reduce the risk factors associated with multiple diseases, especially cardiovascular disease. That's
I'm looking at the
That's what the cardio. Oh, God. We have Selena. Action.
Oh my god, workout. Oh, hey Selena, what's up? Hey Stacy, I just got done lifting. How about you? Oh, nothing much, doing cardio, getting my heart rate up. Cardio? Muscular endurance. I stuck it.
That's right, Selena. Women remain more likely than men to present the advanced disease and experience higher risk of Oh, shit. Action.
Oh, that's not all about cardio. What? It's not all cardio? Yeah, you have to have a balance of cardio and weightlifting. Why is that, Stacy? Because muscular strength and weightlifting